Hey, this is Dr. G, and welcome to Engaging Minds, where we like to look at our world from a deeper, more psychological point of view. And I'm very excited about our subject today. It's on the biopsychosocial component of addiction. And the honored guest who's going to help us dig deeper is Dr. Evelyn Higgins. She's an internationally recognized expert on substance abuse and process abuse. She's an award-winning radio show host, sought-after keynote speaker, and founder of Wired for Addiction, and my new friend. Dr. Higgins, it's a pleasure to have you on.
Thanks, my bestie, Dr. G.
Thanks, my bestie, Dr. Higgins. So, Dr. Higgins, one of the things that I find really hard to deal with as a clinician, as a clinical psychologist, is this idea that patients have so much shame when it comes to their addiction, that they feel as though if they had more willpower, that perhaps they have a moral flaw, and that's what's causing them to have this addiction, they'd be more successful in their recovery. And what I've come to understand is there's such a powerful biological component when it comes to addiction. And when I found out about your work, I was so excited because you delve in so deeply to help us understand what that component is. So I'm wondering if you could share that with our audience.
Absolutely. Great opening question, Dr. G.
Thanks.
Because you know what? Addiction is not a moral flaw. Yet still in 2023, with where we are with science, we still put that drape around the whole process of addiction. And that can bring somebody to an even worse place than where they're at, to start to own there's something within me. So what we do at Wired for Addiction is take a deep dive into someone's physiology and see biomarkers related to addictions, to substance abuse.
So what kind of biomarkers do you find? And here's a two-part question.
Sure.
Are they different for someone who may have a substance abuse or alcohol, be an alcoholic, versus someone who has a behavioral addiction, a food addiction, etc.? I'm just fascinated.
Right. So great question. There's not a gene per se for each one of the addictions. What we do is we look at 85 different biomarkers, starting with neurotransmitters, hormones, and then I'm going to use a science term here, but we won't lose anybody.
I love science. No. I actually am someone who likes science.
So it's a SNP. That stands for single nucleotide polymorphism. All that means is that there's an error in genetic coding. So we can identify that, we isolate, we identify, we measure. When we do that, we can now pinpoint those biochemical pathways that are troublesome for that individual. So be it a mental health situation, anxiety, depression, OCD, ADD, ADHD, be it alcohol, drugs, sex, gambling, pornography, whatever it may be, we are going to see where those weaknesses lie. It's just that individual found pleasure in whatever substance or what they chose as their way to self-medicate.
Exactly. And one of the questions, again, as a clinician, because that's my role, is I go, okay, that's great information, Dr. Higgins. How can I apply that when I'm working with a client? How can someone apply that when they're working with a loved one or in a family?
Right. So oftentimes when we go over someone's lab panel, they actually start crying.
Yeah.
Because all of a sudden you can identify, and it's not me wanting to be this way and upset the apple cart in my life and everybody around me life, but we've identified what's going on. So let's say,
I imagine that must be an incredible relief for someone.
Oh gosh,
to have so much pressure to go, oh, okay, now I have something concrete to deal with. Now I have something to understand about myself. That, again, coming back to our original statement, this isn't just a moral flaw or a lack of willpower.
Right. It's a disease. And we start
it's like diabetes or whatever, heart disease.
Right. Somebody has diabetes. We don't ask them why they're so weak. But if someone has an addiction, that's fair game for a question, or so we think. So we identify these biomarkers, what that does for the individual as well as for their loved ones. All of a sudden they say, I get it. You know what? Had I never even talked to you and did any intake, we would still see the picture of how that you are acting clinically, the clinical correlations to what we're finding in the biomarkers. So for the individual, for anyone in their world, all of a sudden it starts to make sense.
Yeah, that is the key. It starts to make sense. They can start to put their narrative, their life story together. And I guess it would be a great help for like a psychopharmacologist or a psychiatrist in their treatment and choice of medication.
Absolutely. That's one of the lab tests that we do. We don't have the patent on that like we do for the Wired for Addiction panel, but on the pharmacogenomics. So that you take someone's sample, just like we would do any kind of buccal swab, and we would then see what medications would be healthy for them, would not have any adverse effects, would be effective for them, or would be ineffective for them. I can't tell you how many times someone's been on an SSRI medication or an antidepressant, 10, 15 years. And then we do these lab tests on them. We're like, first of all, you have no serotonin. So that was not the one that was going to work.
That wasn't a great choice. Let's do something else.
Right. That wasn't a great choice. On top of that, when we look at that particular prescription in your labs, we see that it's cautionary, that you're going to have adverse side effects. So all those other things that started happening as a result, it makes sense. We shouldn't be guessing in 2023.
I think that's the key element. We shouldn't be guessing, and the science is there. What I love about what you do, it's something I do in my own work, in my company, Daranaut, which we do concierge detox and alcohol rehab in the privacy of someone's home. There's a plug. But but the reason I do it is because I really feel that there has to be individualized programs for each person, that each person who comes to us has a different, as you would say, genetic makeup, or we would say behavioral makeup. That's the behavioral component of why they do what they do. So having that information is tremendously valuable. And what it also does, I believe, Dr. Higgins, is we can separate the person from the illness and go, okay, that's an illness. That's not you as a person. We're going to make you dynamic, successful, help you find your passion, help you overcome, your addiction. But we also have to deal with the illness, which again is something separate. And then we're going to put you back together again, like Humpty Dumpty.
Yeah, absolutely. Absolutely. I mean, we talk about addictions as a biopsychosocial disease, as this triangle, yet that bio part really has been left out.
That was my attraction to your work. I have always felt like I just skim over it in my work, and because we're trained as psychologists to go, well, it's nature and nurture. But when someone asks you questions about nature, you never really know how to answer it. Just go, well, it's complex, and I don't really know what to say, because there wasn't really, the work wasn't there, or I wasn't aware of it until I found out about your work.
Right. So much of the technology that we use has only been made available within the last several years. It wasn't something that we had yet. So what happens, we both know, when we're in the health medical world, it takes time for people to think a different way. It takes time to disseminate information. And we shouldn't, as we said earlier, we shouldn't be practicing like it's 1950 or 1970 when we have this technology available.
No, I agree completely. And, you mentioned the biopsychosocial element. We're talking about the psycho, but what about the social element? How does that play into it in your opinion?
Sure. So one of the particular SNPs, those polymorphisms that we look at, would tell us that someone sees the world as the glass always half empty.
Okay.
And when you identify that, you're like, wow, doesn't that make sense for this individual? But for that person themselves, they sit back and say, you know what, I do. Okay, so if we'd identified that.
Do you feel people are predisposed for that, like genetically?
Sure.
Okay,
yeah, that's what we're looking at, predispositions. So someone would say, I do always view the world that way. Okay, now that we've identified that, we're going to work on the physiology of that. Let's work on the action steps of that. Let's work on the behavior, what you do. If we know that's your go-to, every time you get there, like time out, right? Yeah.
But you know what I love about that? Because suddenly I felt, okay, I grew up in a family that doesn't look at everything half empty. It's completely empty. I mean, there's just no hope no matter what. Why even bother? But now that I feel like, oh, okay, well, that's something through my own growth, therapy, etc., I've had to learn to deal with. I go, oh, okay. It makes so much sense that I would be biologically, genetically predisposed to that. You just have to meet my parents and you could completely understand where it's coming from. But what it does for me in my own understanding is, even in that moment when you said it, I went, oh, okay. Well, no wonder I think that way. It didn't
Right.
all become so personalized that there was something inherently wrong with me.
Right. Right.
And I think that's so powerful. I was wondering, you said about society, like, this isn't 1950s, this isn't 1970s. How do we get society to catch up with the scientific, understanding of what you're doing? Because people are so entrenched in their belief system.
Right, right. It's education, and it's things like what you're offering here on your podcast. It's having talks, it's getting that information out there, sharing with other physicians, with other clinicians, with other therapists, saying this is going to make everybody's job easier and we're going to have better outcomes. So, let's start to bring this information into what we do.
Let's start creating a change. Can you also try to, apart from, we talked about addiction, or what we call process addiction, but for our audience, things like gambling addiction, sex addiction, shopping addiction. Can you actually test for those too? I mean, are there markers for that?
So they're, like I said earlier, it's not going to be identified. Okay, here's sex for you. Okay, here's alcohol for you. It's going to be those biomarkers that tell us where the weaknesses are. And it's what that individual first finds as the self-medication, which becomes their go-to.
Got it.
I'm sure you see people with multiple addictions. It's because they found pleasure in the self-medication of more than one.
Yeah, I was just going to go there. A lot of times, like I said, one of the things I've worked a lot in is in the obesity community. I worked for a bariatric center for years where I had to do the intake. And I noticed that, a couple things, especially around obesity and food addiction and, binge eating, there was so much shame because people just feel, well, that person's, obese because they have no willpower. And the person believes that too. But what I noticed, that even when they have the bariatric surgery, many times, and they'll lose 100 pounds, they cross addict.
Yeah.
They go into alcohol, or they go into, like you said, a behavioral addiction. So it seems like the addictive component is just so powerful within their genetic makeup.
Right. How many times do you hear out of your patients that, okay, I'm going to stop drinking, and then they're, okay, I started on XYZ pill or whatever. There's that, I just switched.
Yeah.
And you kind of try to kid yourself for how long that goes on for in each individual. I haven't drank in 6 months, but now I find myself.
I'm smoking pot every day. So that, right.
Exactly. Yeah.
And it's okay now that it's legal. I can do it every day as though.
I was going to go there, but I thought we're going to get complicated with the legality of it.
Well, yeah, but I mean, just because alcohol is legal doesn't mean you have to drink it incessantly all day.
Right.
So how about, okay, so if someone comes to you, what is the actual process, the testing like? What would someone go through if they came to Wired for Addiction?
Sure, great. So we see people all over the world like you do, and we would drop ship the lab kits to them. Like any other kind of collection samples, we get instructions from the office: don't eat these foods, don't do this, don't do that, for 48 hours prior to the sample. Take the samples, they go off to the lab. We get that information back about 2.5 weeks later. From there, we create what's called a biomarker evaluation report, where we go over each one of these 85 biomarkers, and you clearly understand how you wound up where you are. And then we go over the protocol, what we're going to do to change those biochemical pathways. And that's the whole epigenetics, another science.
Right.
But the really cool stuff that exists today that we know we can do.
Yeah. And then, a person like me steps in and go, okay, well, here's all the triggers you need to start avoiding so your biology doesn't take control of you.
Right.
Or what about what about things like depression or anxiety? We talk a lot in our field about dual diagnosis,
Correct.
where I feel as though it's usually quadruple diagnosis when someone has addiction. It could be strong elements of depression, anxiety, PTSD, etc. Is that incorporated into your testing?
Absolutely, because almost everyone, and I say almost just to do a disclaimer out there,
Sure.
really everyone has a dual diagnosis, and as you say, a quadruple diagnosis. Everybody does. The addiction is just the self-medication of what's the underlying factor. Is it anxiety? Is it depression? Is it OCD? And the list goes on. And those things have been diagnosed and maybe treated incorrectly or undiagnosed this whole time. So that's a big part of what we do, or else this is just going to be part of the cycle. If someone's been to rehab how many times and proudly tells you, I've been there X amount of times, because you never got to this foundational aspect of your.
And you never embraced it or really understood it, that this is, so when I say to someone, well, you just can't drink, and they'll go, well, maybe I can have one. That's always, the bargaining. And I'll go, no, actually having your work would reinforce for me to say, well, based on your biology, that's never going to work out.
Exactly.
And here's what I love. That isn't my objective opinion. That is the science. Just like when we do psychological assessment, and so I'll give someone a report and I'll say, look, this isn't my opinion. This is based on these validated, highly reliable tests, and this is what they're telling you. So and it helps me a great deal in my work, because then I could just have something concrete to keep going back to. Like, this is what's going on for you.
Yep.
If you're a diabetic, you can't eat whatever. You can't eat sugar.
Right.
If you have high blood pressure, stay away from salt.
Right. It's objective data. Again, in our field, it's the only place where they'll say, yeah, I don't think so, and I don't agree with that. What do you mean? We have diagnostics, right? And,
I go ahead.
I was going to say, we've been doing it like subjectively for so long that somehow those taglines have become okay.
Yeah, well, that's what I mean. And a lot of times, because I just didn't have the knowledge, I just dealt with this with a returning client with alcoholism. And he was about to start our program. And then literally the night before, his sister wrote me and said, well, he thinks he's doing okay, so let's not put pressure on him. Now, this is a guy that's been through our program about 3 times, other programs. And I just made a statement to her and I said, okay, but he's a binge drinker. So he's going to be okay for a while.
Yep.
And then he won't be okay. And that's the pattern he goes through. And she got really angry with me. She said, well, Dr. Glass, I wish you gave him a little bit more hope. I said, I'm just telling you the facts. That without help, it's going to be really hard for him to do it, because that's his nature. Right. So had I had your test to be able to put in front of the family and said, look, this is backing up my observation.
Exactly. And with family, great point, because it's not just the individual. We'll get calls, we'll get emails from family members the day that after we've gone over the information that week, saying, oh my gosh, that's exactly who my loved one is. And thank you so much, because I understand it now. And it's showing him or her that you don't have the wiggle room.
That's perfect, doctor. You don't have the wiggle room. Do what you want with the information, but it's not our subjective opinion.
Correct. Yep. Do what you want with the information. Absolutely. You're not going to be the guy that can have one drink and walk away.
Yeah, it just is what it is. Like, I know that's not an issue for me. I don't really like drinking very much, so I can have a drink and walk away, but that doesn't disqualify me from having other issues. So, I explain that to patients. I want to explore very quickly this idea of how do we get, maybe in a deeper way, society to accept this work and get rid of more of these preconceived notions of, addiction is just willpower, because I think that will help a lot with creating certain legislations or
Right.
public policies when it comes to dealing with addiction, especially like we see the fentanyl crisis.
Right.
So I'm wondering if you had, how can we bring this to a political level is what I was thinking of.
Actually, we do a lot of work in DC and on the state level. We're out of
Fantastic.
Florida in Tallahassee. We are there probably quarterly to keep on saying this exists, this science is there, and they
Yeah.
love to. So it's just pushing, doing the grind, doing the grind, doing the grind, because that's the only way we're going to change things.
That's exactly it, that people move very slowly and
Right.
legislation moves slowly. So
Right.
you just introduce it over and over again. It's like when you're working in therapy and 2 years later, a patient comes to you and said, I had this great idea, Dr. Glass, and they'll tell you what it is. And you're thinking, I actually mentioned that to you like 2 years ago,
Right.
and we've been talking about it since, but hey, you're there now. And that's all that really matters.
Exactly. Meet somebody where they're at, right? You in your mind, you're saying, wow, we did this already. But if they finally, if the
Hey,
light bulb went off, we're there.
right, exactly. So, Dr. Higgins, if people wanted to find out more about your work and Wired for Addiction, how can they get in touch with you?
Sure. So our website is wiredforaddiction.com. You can go on there. We work with individuals, we work with practitioners like yourself, treatment centers, and we work within the justice system, even incarcerated people. So go to the website, take a look at it, everything. If you think this is something that you'd like to talk out, we do offer even a 15-minute consultation, complimentary, just to see if this is something that would be a fit for you. What have you done? What have you not done? So, share it, see what's going on, for sure.
I want to thank you so much for coming on the podcast on Engaging Minds. And I love when you did the little triangle, like our listeners can't see it, but it was biopsychosocial. And I feel as though you gave me this great tool to go, oh, you want to talk biology? Let me put you in touch with Dr. Higgins and her Wired for Addiction, because they're experts to help us understand what the biological genetic makeup is of someone who's dealing with addiction. So again, I want to thank you so much. I want to tell our listeners, if you missed any of that information, you can always contact me at darrenaughthealth.com, and we can forward the information to Dr. Higgins. Dr. Higgins, it was a pleasure to have you on.
Dr. G, my pleasure. Thank you so much.
My pleasure. Take care.